Silent cities, shops shuttered, and hospitals overwhelmed. Generations changed by a once-in-a-century pandemic.
The striking conclusion, I think, from this report, though, is that right now we are arguably worse placed as a country to deal with a pandemic than we were in early 2020.
The report finding Australia's response to the pandemic drove a large decline in public trust.
Many of the measures taken during COVID-19 are unlikely to be accepted by the population again.
Delays in the vaccine rollout, prolonged restrictive public health measures and ultimately cost $31 billion. And the report said some of those measures, like school closures and lockdowns, must be used carefully.
Because of the strength of the public health response, a lot of people felt, they didn't trust what government was doing.
Heavy-handed restrictions also amounted to a lack of compassion, according to the inquiry. That's something acutely felt by Richard Smith, whose wife was in an aged care home. His family was unable to see her for months.
The distress was not only felt by the residents, but by the family to see the distress that their loved ones were going through.
But despite all the issues, the report stressed Australia fared well compared to other nations.
We saved lives and we saved livelihoods, and I think Australians should be proud.
One of the recommendations has already been acted on, funding a Centre for Disease Control.
An opportunity to lay a foundation for Australia's future pandemic preparedness.
The toughest decisions on lockdowns, school and border closures and vaccine mandates were made by the states and territories and weren't directly covered by this inquiry. But even so, it was highly critical of poorly justified and disproportionate approaches to restrictions across the country. With goodwill deeply eroded, the report plants serious doubt about whether a less trusting public would even follow better targeted rules in the case of another pandemic. Stephanie Dalzell, ABC News, Canberra.